Senator Ravalia.
Thank you, Madam President. Honourable Senators, it is my pleasure today to speak to you as the sponsor of Bill C-284, an act to establish a national strategy for eye care and to designate an age-related macular degeneration awareness month. Our vision allows us to experience the beauty of our world, to connect with others, and to navigate the complexities of daily life. However, for too many Canadians, vision care is a luxury. Access to essential vision care services remain a challenge, and it's one that we must address with both urgency and compassion. Advances in technology and virtual care have opened pathways in this regard. Vision care is an integral part of a comprehensive healthcare system, and we should make it a priority to ensure that high-quality vision care is accessible for all. In my clinical practice, I have witnessed the tragic sequelae of preventable ocular diseases, in many instances purely on the basis of a lack of access or affordability. Vision impairment, whether through experiencing visual challenges or requiring assistance, such as glasses, contacts, or other aids, has touched the lives of virtually everyone, either directly or through loved ones. Before I begin, I want to express my gratitude to MP Judy Scrow, who has championed the efforts towards a national strategy for vision care in the other place, and has been a national advocate for people with age-related macular degeneration and various vision health issues. I also applaud the careful thought and consideration by members of the Standing Committee on Health in the other place. This past spring, members carefully studied this bill and helped maintain the federal and provincial jurisdictional limits on healthcare, professional training and guidelines. This bill passed with resounding unanimity, underscoring the collective recognition of the importance of vision care in our society. We are presented with a unique opportunity to champion a cause that touches the lives of individuals, families, and communities across our country. The vision loss crisis in Canada requires a coordinated response, and this is what the National Eye Care Strategy is all about. Over 8 million Canadians, or 1 in 5, have an eye disease. There are 1.2 million Canadians who live with vision loss or blindness. There were over 1,200 deaths associated with vision loss in 2019 alone. Meanwhile, 75% of vision loss cases can be prevented if patients are diagnosed early and have access to treatment. Colleagues, the need for a national strategy is necessary to address the gaps and inconsistencies in access and delivery of vision care across the country. As we know, with our 10 provinces and 3 territories, it can feel like we sometimes have 13 separate healthcare silos, or that we live in 13 fiefdoms. Basic eye examinations are not universally covered under provincial healthcare plans. Some provinces provide coverage for specific groups, such as children, seniors, or individuals with certain medical conditions. Many Canadians rely on private insurance plans to cover the costs of routine eye exams, glasses, and contact lenses. But even with private insurance, there may still be out-of-pocket expenses for vision care, especially for individuals who have no coverage. The cost of eyeglasses, contact lenses, and certain eye treatments can be a significant barrier for Canadians accessing the necessary care. Accessibility also depends on where you live, with urban areas generally having better access to eye care facilities than rural or remote ones. Practically speaking, this can impact the ability of individuals to access preventative care and may contribute to delayed diagnosis and treatment of eye conditions. By detecting these early, the healthcare system can avoid the costs associated with advanced treatments and complications. The challenges associated with the delivery of vision care services have been exacerbated by COVID, with many Canadians missing regular eye appointments, surgeries, and other treatment plans, increasing the risk of more complications. Vision loss has a profound impact on individuals, their families, and society, costing our economy an estimated $32.9 billion a year. Of this cost, $4.2 billion is attributed to reduced productivity in the workplace. Over half the cost, $17.4 billion, is attributed to the reduced quality of life, which is primarily due to a loss of independence, especially in our aging demographic. Over $983 million was spent last year across Canada on injections to treat macular degeneration. Losing one's vision increases mental, financial, and social hardship. It can lead to a loss of mobility, an inability to live independently, to drive, to read, or to participate in physical activity. It can result in a loss of social interaction, which can often lead to loneliness, isolation, and the mental sequelae thereof. A national strategy can promote cost-effective and efficient use of healthcare resources and dollars to help combat vision loss across the country. The bill that is before us today is straightforward. It calls for the Minister of Health, in consultation with representatives of provincial governments responsible for health, Indigenous group, and other relevant stakeholders, including healthcare researchers and practitioners, to develop a national strategy to support the prevention and treatment of eye disease, as well as a vision rehabilitation plan to ensure better health outcomes for all. It outlines a strategy that encompasses preventative care, early detection, treatment, and accessibility. The strategy would aim to raise awareness of the impact of vision loss and blindness, improve eye health care, and support and foster innovative research to advance new therapies for vision loss and rehabilitation. The bill is also calling on enhanced access to eye health care for Indigenous people. While there are benchmarks, including timelines, by design, it is not overly prescriptive in what the strategy itself should entail. The government must be allowed the flexibility to respect the consultative process of this legislation. This legislation would ensure a coordinated national strategy aimed at ensuring Canadians have access to vision care regardless of where they live. It also recognizes Canadians' experiences and struggles with age-related macular degeneration through a designation of February as Age-Related Macular Degeneration Awareness Month. AMD is a condition which affects many Canadians over the age of 55 and is the leading cause of blindness amongst these Canadians. I know that many of us are in this demographic. This condition affects the central vision, which is the most important part of an individual's eyesight. It is a progressive condition that leads to vision loss and may increase the risks of other health concerns like anxiety, depression, and progression to dementia. As our population ages, we must be vigilant in promoting awareness around AMD, increasing accessibility to currently available treatments, and supporting the necessary research for developing new treatments needed by many Canadians across our provinces and territories. We have the opportunity to be one of the global leaders in the delivery of vision care. We can draw from strong examples in other nations for service delivery and accessibility in vision care. While we know that there is no one-size-fits-all model for the delivery of care across different countries, the strategy would examine existing strategies, frameworks, and best practices, as well as lessons learned from other jurisdictions. Honourable colleagues, a national strategy would address the wide inconsistencies in access to care, work to prevent and slow the progression of vision loss where possible, help us tailor services to the needs of all Canadians in a culturally appropriate manner, and allow us to foster research and innovation to better inform policymakers on this issue. This bill is important to millions of Canadians and is long overdue. Let us acknowledge the tireless effort of healthcare professionals, advocacy groups, and individuals who have championed this cause and been calling for federal leadership. Their commitment to the well-being of Canadians deserves our utmost respect and support. Making eye health and vision care a health priority requires all of our support. Colleagues, we can work together to ensure that 1.5 million Canadians with sight loss are provided the necessary supports and the opportunity to live productive, healthy lives. Miigwech, thank you, merci.
Senator Duncan, you have a question?
He's done his speech just very fast.
Senator Duncan.
Thank you very much for your remarks and for your introduction of this bill, Senator Ravalia. One short question and then a supplementary. Which committee do you envision this bill going to?
Senator Ravalia.
Thank you, Senator Duncan. I envision that this would likely go to SOCI.
Senator Duncan.
Colleagues, I would just note for the record that this is likely the third bill we've discussed this afternoon, and SOCI's task list is getting to be quite large. There's quite a lot before them. And I would also like to ask that, following up on your comments about the fiefdoms that are the individual provincial healthcare systems, that we ensure that non-insured health benefits be added to that list, that it's actually 14, not 13 healthcare plans that exist in this country. And there is quite a difference between what is paid for eye care for non-insured health through non-insured health benefits for Indigenous people than what is paid for others under healthcare plans. So I just ensure that when we do refer this bill, that we ensure that Canada is included in the responsibility for healthcare, eye care accessibility. And just another question, was the standards and licensing of those involved in optometry and delivering eye care, was that also part of the discussion in the framework for eye care legislation?
Senator Ravalia.
Thank you for those two critical points that you've raised. In the other place, the issue of Indigenous health was raised, and it is a critical and very impactful area that would be looked at in great detail. There's no doubt that not so much the reimbursement, but it's the access to care with respect to early screening in individuals who live in remote and rural communities that causes significant harm, not only to our Indigenous communities, but to many of our rural constituents. The second part of your question, I think, is very much a provincial jurisdictional issue. However, licensing for optometry, and having previously served on Newfoundland and Labrador's optometry board, there is a pretty uniform acceptance across the country that there are base standards that have to be met in order to be a licensed optometrist. And in terms of licensing requirements for those who have trained abroad, there are pathways to ensure that there is ready access. But I thank you for those questions.